My name is Nicki. Today we're going to be seeing a 25-year-old Caucasian female with complaints of weakness. Upon coming to the clinic, her assessment or her vital signs are as follows. Blood pressure 122/70, heart rate 120, respiratory are 20 on room air, and afebrile temperature 98.2. Hi Molly, I'm Nicki. I'll be the nurse practitioner today. Can you tell me what brings you in?
Hi, I've just had some left arm weakness. I'm not sure if I pulled something or...
When did you notice it?
This past weekend, and it's just gotten kind of worse the past couple days.
Has this happened before, this left arm weakness?
No.
Is it anywhere weak in your left arm, left leg, anywhere else?
No, just that left arm.
Okay, no falls related with weakness?
No, not that I can think of.
Okay. Any other symptoms associated with it? Numbness, tingling, headache?
A little bit of numbness and tingling in my hand, and I get a headache every now and then at work.
Okay, what do you do for work?
I'm a nurse.
Okay, so what do you think happened to your arm?
I don't know, I might have just pulled something. I lift patients a lot, so...
Okay, any back pain?
No.
Okay. Are you able to move your arm in all directions like normal?
Mm-hmm.
Good. And what about any medications you take?
No, I don't take anything daily.
What about any trauma that you know of?
No, I mean, I did have a bachelorette party this weekend, so I might have fallen then, but nothing that I can think of.
Okay. No headache right now?
No.
Okay, you said you had a headache. Does it get worse throughout the day?
Yeah, it's usually worse when I'm at work, and it's just been getting worse these past couple days.
Okay, does any make the headache worse or make it better?
No.
What about the weakness in your arm? Anything make it worse or better?
No, I just notice it when I'm doing something. When I'm just laying there resting, I don't notice it.
And the numbness and tingling that you said you had, when does that start?
No, whenever I'm trying to do something, it seems like.
Okay, so it's associated with the weakness, you think?
Mm-hmm.
And it just on that left arm, right? No
Yeah.
numbness, tingling in your feet or...
No.
Okay. Well, what about any allergies? Are you allergic to anything?
No.
And you said you're not taking any medications. Anybody you've been around been sick?
No.
Okay, so she's not taking any medications. We can rule out polypharmacy. And any surgical history?
No.
And any other medical history that you know of personally?
No, all my family's pretty healthy. I mean, I had a brother that died from something to do with his brain when I was younger, but other than that, everyone's pretty healthy.
Okay. Well, what about chest pain? Any chest pain or
No.
pressure? What about sinus pressure? Runny nose, ringing in your ears?
No.
Any eye pressure behind your eyes?
No.
No. Any sore throat or tightness in your neck that you've noticed?
No.
No. And you said no back pain. You're still able to move and bend at work?
Yeah,
Good.
Okay.
Good. Well, what about stomach problems? Any nausea, vomiting?
No, I've been okay.
Good. What about double vision, blurring in your eyes?
No.
Okay, good. No dizziness?
No.
Good. Now we're going to run through a quick assessment and make sure everything checks out, see what's going on.
Okay.
So first we're going to run through some cranial nerves here. We'll first take a look in your ears. Make sure if there is any trauma from the past weekend, we're not seeing anything. Ear canals are clear. No signs of obstruction, hemorrhage, bleeding. Equal bilateral. And take a look at your eyes. Assessing 3, 4, and 6. Go ahead and watch my pen light here for accommodation. Eyes accommodate. All 6 visual fields. Assessing for any nystagmus. Eyes move in a smooth, gradual, equal bilateral rate. And as far as your pupil size, they are equal bilateral at about a 4. We'll also assess your optic nerve 2 for equal accommodation, direct and consensual. Pupils are direct and consensual. So your eyes look good. Everything neuro-wise is looking good there. And any dizziness or photophobia, flashing lights making you nauseous, good. So now we're going to assess the cranial nerve, number 5, the trigeminal, since you're having some sensations that's bothering you.
Mm-hmm.
So I'm going to have you feel with something soft and something sharp. And I'm going to ask you if they're the same on both sides, okay? Let me know if anything feels abnormal for you.
Okay.
So go ahead and close your eyes. And what do you feel?
So.
What do you feel?
So.
What do you feel?
So.
What do you feel?
Soft.
Are they equal?
Yes.
Okay, and here?
Soft.
Here?
Soft.
Are they equal?
Yes.
Good.
Sharp. 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 Sharp.
Are they equal?
Yes. Sharp. Sharp.
Are they equal?
Yes.
Good.
Sharp. Sharp.
Are they equal?
Yes.
Good.
Sharp. Sharp.
Are they equal?
Yes. Soft. Soft.
Are they equal?
Yes.
Good.
Soft. Soft.
Are they equal?
Yes. Soft. Mm. Sharp. Oh, I can feel you touch me, but I don't know.
Your finger
Sharp. Soft. Not sure.
So upon assessments of the hands for trigeminal nerve number 5, the left hand and fingertip are abnormal compared to the right, unable to determine soft and sharp, or that I'm touching her at all. So we'll also do the lower extremities to assess for sensation. Go ahead and kick your shoes off for me. Alright, and keep your eyes closed.
Soft. Soft. Sharp. 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 Soft. Soft.
And are those equal on both sides as well?
Yes.
Good. So lower extremities are intact for trigeminal number 5 on both soft and sharp. Now we're going to do some proprioception. I'll move your toe in a direction. You tell me if I'm moving it up and down. So go ahead and close your eyes again.
Up. Down. I thought you moved me, but I don't know where.
Okay, so patient unable to determine proprioception on the left toe, but appropriate on the right. So we'll go ahead and assess your upper extremity as well. So go ahead and close your eyes and hold your hand out. We'll do the same thing. Down or up?
Up. I thought you moved me, but I'm not sure which
You
way.
don't know whether if it's up or down?
No.
Okay, so go ahead and open your eyes. Now we're going to do 2-point discrimination. So this would be 2, and this would be 1, and I'll have you tell me if it's 1 or 2.
Okay.
Okay, so go ahead and close your eyes again.
1. 1. 2. 2. 1. 2. 2. 1. 1. 1. 1. 1. I'm not sure.
Patient unable to identify point discrimination on the left hand, but appropriately on the right. Now we'll go down to your lower extremities and check for point discrimination.
2. 2. 1. 2. 1.
Patient able to appropriately identify point discrimination on her lower extremities. So on point discrimination, the only abnormal finding was in the left hand and fingertips. Patient unable to identify that I was touching her at all. So now we're going to quickly move to your reflexes. Make sure everything's still intact. I'll have you just relax your arm, make it go limp. We'll assess for 6 and 8. Grade 2 equal. Bilateral is what we're looking for. Reflexes are equal bilateral, grade 2. We'll do your lower extremities just to check out. Here. Go ahead and interlock your fingers and palm real tight for me. Good. Patellar reflexes is grade 2 equal intact. And we'll do your Achilles here. Achilles reflexes equal bilateral, grade 2. So, I think we've done all of our assessments. While you're sitting down, I'm going to have you stand up. We'll just take a look at your gait. And I'll have you walk in a straight line, toe to heel, assessing for any abnormal swaying or in smooth turns. Go ahead and turn back around. Patient has a steady gait, equal to walk with no abnormalities or swaying. So I'll have you close your eyes and put both hands out now. And we're assessing for Romberg and the pronator drift. We've got a positive rotator drift on the left side. Go ahead and open your eyes. We'll have a seat back up here. We'll assess for strength here real quickly. So I'll first have you do your thumb. Go ahead and make the OK sign. And I'm going to try to break it. Don't let me break it. This is assessing number 6. So we have grade 5 strength on the right and grade 2 on the left. So we'll also do your wrist now. Don't let me push down. And don't let me pull up. So we have grade 5 strength on the right and grade 2 on the left. We'll also do your elbow strength here. I'm going to push towards you and you push out towards me. So grade 5 on the right, grade 2 on the left, and pull. Grade 5 on the right and grade 2 on the left. We'll do your shoulders now. Make a T. Don't let me push down. Grade 5 on the right, grade 3 on the left. Go ahead and put your shoulders to your side and wing them up. Don't let me push down. Good. So grade 5 on the right and grade 2 on the left. So our abnormal assessments, our left arm does definitely appear to be weaker than the left. Sensations are abnormal on the left arm. And we'll do some sensory for your stereognosis and graphesthesia. Go ahead and close your eyes. I'm going to give you an object. Can you tell me what it is?
A pen.
Good.
I'm having some difficulty gripping it.
Patient having difficulty holding an object in hand and able to describe what I gave her. So unable to identify object in the left hand compared to the right appropriately. Go ahead and hold your palms flat. I'm going to draw a number. You tell me what it is. Go ahead and close your eyes.
3.
So this is assessing graphesthesia. Appropriately identified number 3 on the right hand.
I felt something, but I'm not sure what it was.
Patient unable to identify number or letter drawn in the left hand. So go ahead and open your eyes. So it seems like we do have something going on we might need to look into a little deeper. So upon assessment of my normal findings, my first differential diagnosis would be Chiari malformation, one with her history of her brother having some brain diagnosis that he passed away from, and her complaining of the left-sided weakness, numbness, tingling, and the sensation absence with denying the back pain or any other abnormal movements of her arm or range of motion. And another secondary diagnosis would be the tumor. So if we have a tumor, maybe her brother had a brain tumor that he had passed away from. And the third diagnosis would be TBI or traumatic brain injury. Maybe over the weekend she did hit her head and we've got trauma there that we need to go in and discover. And thank you very much for your time.